So if you see, there was a reduction, but very, very minor compared to the active group. So if you see, it was from 9.4, it has come down to 8.1, whereas there, if you see, the results were much greater than this. Okay, coming to fasting blood sugar. So again, here, if you see, so all this, the entire stuff is available on the with the book. So if you all want further details, you all can refer that. So here too, if you see the baseline, the fasting blood sugar was 165, and it has come down to 125. So besides these parameters, it is also not, see, many doctors will only look at the parameters. They will treat the lab report and not the patient. But Amrith Noni is one product wherein we can confidently say the doctors also, the lab reports also gave very good results, and their personal experience, the personal feedback that we got from the patients was also very good. So this is again, in comparison, the placebo group. So this is the postprandial blood sugar. So again, here if you see, over a period of 6 months, very, very good improvement in the active group. And this is the placebo group. So besides diabetes, we also did the lipid profile. That is, we wanted to see how the cholesterol is affected with this particular product. So again, the results were tremendous. So this is, if you see the total cholesterol, triglycerides, LDL, HDL. HDL improvement was a very good factor, because if you see, almost everyone had a very good improvement of HDL. HDL actually, they consider it the good cholesterol. So that one improving, it was a very good sign. So this in comparison with the placebo group. So this is some of the summary about the trial. So it's not that we just take a random hospital and conduct the trial. So this hospital has the ethics committee, which is registered with the Central Drug Standard Control Organization, that is the CDSCO, which directly comes under the Ministry of Health. So if you see the ethics committee, that is, so if you see that ECR 809-INSTK, so that is the code for the particular hospital. So if you go to the clinical trial registry website, that is www.ctri.nic, and you put in that code, you will get the certification of the government certification of that particular hospital. So these are the other details, like when we started the trial and when we completed it. So totally 30 subjects we have taken, and out of 30, all 30 completed the study, and 2 subjects were screen failures. Screen failures has nothing to do with the product, that even before they enter the study, we will take them off the study because they do not meet any of the inclusion or exclusion parameters. So again, this is again a very important thing. If you see this, the CTRI number. So as I told you all, if you all want more details about this study, it is there on an open website, which is www.ctri.nic. Once you go to that website, you put in this particular number, you will get the entire list of this study, the summary of the study. It is registered with the CTRI. So only after we got the CTRI registration number, we started the study. And ICH GCP guidelines, so this is a global standard. So whatever standards we followed for this study, whether you do it in America, whether you do it in Canada or South Korea, Brazil, wherever you do it, the global standard is ICH GCP. That's the International Conference on Harmonization for Good Clinical Practices. So this study was conducted in total compliance with ICH GCP. So this was how we started the study. So first 5 ml was given to them. So we were advised to take 2 times a day. So 5 ml in the morning in the empty stomach, and in the night, just 1 or 1.5 hours before their food, again 5 ml. So the reason why 5 ml first was so that they just get used to the product. So first 3 days 5 ml, then 10 ml, and then throughout the entire study, they had taken 15 ml. So these are the more specifics about what happened and how many male-female ratio, what was their height, weight, the other parameters, the vital signs and all that. So if you want more information on this, specific information, it is present in the clinical study report. So the main study highlights, which I would like to highlight now. So all the patients were very, very happy with the product. So as I've told you all, we have conducted n number of studies. And one more thing which I would like to appreciate value products is, see, most of the studies which we have conducted, the manufacturing will be somewhere. The sourcing of the products, whether it's a herb or a fruit or whatever thing, the sourcing will be from another place. And then the manufacturing unit will be different. And they'll be marketing to a different people. So one thing very nice about value products is they have their own place where they grow their actual noni fruits. I have been there personally to see that. And I've seen their manufacturing unit, and they're the ones who process it, and they are also giving it to the same our country. There are so many sponsors who do the study and send it to abroad countries so that we don't get benefited. But this is one company where we see that they are focused on the Indian population. And all the patients, they wanted to continue taking the product. Of course, we told them it's a clinical study, so 6 months we have to stop and we have to take the thing. Of course, we then did guide them towards their store in Bangalore to continue taking the product. And overall tolerance. Now, when we say tolerance, see, there are many products which will have very good effect. The person will have a very good effect from that product. But the overall tolerance means they may have other kind of side effects. Side effects, not in the very strict term of side effects, but they'll have some discomfort or some ingestion problem or some gastritis, some minor things they'll have. But this was one product wherein most of them, actually we couldn't include that in the report because that was not our primary objective. This product had very good digestion relief. So many people who could not had problem in digestion issues, indigestion. And another very good improvement was, see, diabetics have something called polyuria, which is they have frequent urination, especially during the night time. So many people, all the 15 people, they used to go almost like 5 to 6 times in a night. So you can understand a person going 5 to 6 times for visiting the washroom at night. So what a disturbed sleep he'll have. So that was reduced to almost just once or twice for all the patients. Then at Syncretic, as I told you all, so we also have our own website. You can go to our website. All the studies which we have done is enlisted there, so you can have a look at the website. So among all the studies what we have done, this is the only study which we can confidently say which had 100% results, positive results. So that's about the presentation. So thank you very much for your listening.